Good afternoon. My name is Sarah DeVacia Wisdom, and I'm the President and CEO of Greater Louisville, Inc. Thank you so much for joining us this afternoon for the final installment of GLI's DE&I Conversation Series. Our goal for this conversation is to identify solutions to address racial inequities within the industry and delivery of healthcare. GLI recognizes that a healthy workforce is vital to economic development. That's why we, as the business community, must engage in efforts and public policy to improve health disparities within our communities of color. To help drive this work, GLI formed a business council to end racism, led by Ralph Deschabert of Brown-Forman, Geraldine Green of Yum Brands, and Cynthia Napek of Leadership Louisville Center. Today's conversations will help inform and shape the work of GLI, and we invite your engagement. To the council members joining us, I look forward to the post-event discussions we'll host later today with the Access to Healthcare workstream. I'd like to give a special thanks to our event and council sponsors, our series supporting sponsors, Morales Group Staffing, PricewaterhouseCoopers, and Tops Magazine. Our series event sponsor, the Oliver Group, and our Business Council to End Racism sponsors, Brown-Forman, Humana, and Yum Brands. Lastly, thank you to our presenting sponsor who you will hear from shortly, Papa John's International, for making this DE&I series possible. We really value your support. We recently recruited a new Access to Healthcare workstream leader, Gladys Lopez, Senior Vice President and Chief Human Resources Officer for Norton Healthcare. Thank you, Gladys, for your willingness to volunteer for this effort. We also want to thank Yolanda Burris for her contributions and for helping GLI to establish the Business Council. We wish her well in her relocation. Now I would like to turn it over to Gladys.
Thank you, Sarah. Good afternoon, everyone. I'm truly excited to be with you. I'm originally from Chicago, moved here less than 3 years ago to join Norton specifically for this role. I spent most of my career working for, supporting, and serving organizations who are mission-focused and have a rich history of service to the community. So I can't think of a better time than now to be here in Louisville and work for Norton. I'm honored to be the lead for the Access to Healthcare workstream. We recognize the significant need for the business community and healthcare industry to engage with all our stakeholders. In our 2020 strategic plan, like many of you, Norton Healthcare outlined our efforts to eliminate disparities, systemic racism, and implicit bias within healthcare over the course of the next few years. The reality is we can't wait, and we recognize that we must accelerate our efforts. Our Community Health Needs Assessment reinforced Louisville's Health Equity Report, which highlighted how health outcomes stem from root causes that have been shaped for generations by systems of power. Clearly, different zip codes face different challenges, and the root causes affect the quality of life for those in certain zip codes. Where you live impacts how long you can expect to live. As Louisville's healthcare leader, we know that improving the health of Louisville requires us to change chronic disease outcomes, which have a disproportionate representation on Louisville's Black and Brown residents. We remain committed to this work and understand that we cannot do this alone. It is critical that we all collaborate and collectively work with one another to accomplish this. We will continue to work and leverage our many community partnerships, our support for the Louisville Urban League's West End Sports Complex, Simmons College, Shawnee Christian Healthcare Center, JCPS, YMCA, Family Community Clinic, Kentucky Hispanic Business Council, and many more to remain engaged in this process. Another area of focus is how the business community can impact lasting change to improve transparency, accountability, and establish trust throughout our community as it relates to healthcare. Now is truly the time for all of us to either put up or shut up. The business community will impact lasting change by backing up its words with action. One of our imperatives in addressing health and racial equity is to ensure access to primary care for everyone. We have primary care offices at the West Hill Street and at the YMCA on West Broadway. We are working to establish additional locations for adult and pediatric care in West Louisville and within our Latinx community. To build trust, we asked and listened to our patients. We recognize patients feel most comfortable with providers who look like them and who take the time to communicate with them with an understanding of the cultural uniqueness of our patients. We're committed to staffing our practices with providers who look like and can effectively connect with the patients that they are serving. We plan to have social workers integrated into our clinics through in-clinic and virtual appointments. We're expanding current efforts to address food insecurity by extending partnerships to provide more food pantries and clinics. And we're going to establish staff a clinic with employees who will know and meet the cultural needs of our Latinx community. At Norton, we are pursuing racial equity, building a more diverse leadership team, ensuring equal opportunity for growth, development, and advancement for our staff, and providing more convenient access to primary care for our patients. In June, Russ Cox, our president and CEO, announced 5 imperatives, and we immediately began to work on these to overcome inequalities internally and within our community. Again, what we did was take our initiatives that were part of our strategic plan, and we committed to focus on them in an accelerated manner. Multidisciplinary employee work groups that include employees at all levels of the organization were created to develop goals, objectives, and tactics to achieve each imperative. What is critical is trust. And the same that we do with our patients, we're taking the time to ask and listen to our employees. The groups will hold us accountable to achieving the work needed to fulfill each imperative. And I'd like to share those with you. So our 5 imperatives are the establishment of the Norton Healthcare Institute for Health Equity, which was founded on the premise that healthcare is a basic human right, not a privilege. Dr. Kelly McCants has been named our acting executive director of the Institute, which will focus on identifying and removing obstacles to care in medically underserved areas, exploring and developing community relationships and partnerships, as well as improving access to care. You'll hear more about the Institute from Dr. McCants shortly. Our second imperative is to ensure access to primary care for everyone, providing more convenient and geographically accessible primary care ensures that all community members have an equal chance to live their healthiest life possible. Our third imperative is to mirror our community within the Norton Healthcare leadership team. We have more than 16,700 dedicated employees and providers who work hard for our patients. We recognize more diversity in leadership is needed, not only to better reflect our community and workforce, but to provide us with a needed awareness so we value, learn from, and appreciate differences, uniqueness, and the individuality of our employees. We will ensure that all team members know they can come to work as their authentic self, and they'll have an equal opportunity for growth, development, and advancement. Our fourth imperative is to provide more education and advocacy internally on health policy issues to help our workforce make informed decisions. We want to leverage our collective voice of employees to advocate for vital safety net programs, including Medicaid and SNAP, the Supplemental Nutrition Assistance Program, which are important not only to us, but to the populations that we serve. In addition, we will help to educate our employees on issues that affect them, our organization, and our community. Finally, our fifth imperative is to invest an additional $20 million over 5 years to address health needs in underserved areas. Last year, we announced a $5 million investment with the Louisville Urban League to support construction of the Norton Healthcare Sports and Learning Center in the West End. We recently announced a $1.2 million investment in Simmons College of Kentucky to support its students and programming. The $20 million will be invested in permanent facilities, healthcare services, and programming in Louisville's underserved neighborhoods. This investment is a continuation of our ongoing commitment to eliminate disparities, systemic racism, and implicit bias within healthcare over the course of the next few years. I share what we're doing with you, and I'll turn it back over to Sarah.
Thank you. Up next, I believe we have Victoria Russell from Papa John's International. Victoria?
Thank you, Sarah. Papa John's has been on its diversity, equity, and inclusion journey for more than 2 years. It's so important to the success of our business that we've made creating a culture of leaders who believe in diversity, inclusivity, and winning the #1 strategic priority for the company. As the fight for racial justice continues in our communities and in our country, we aspire to create the kind of culture in our company that we'd like to see in the rest of the world and that we could all be proud of. I'd like to pause here and take a moment to share a video as we deliver thanks. Today, you will hear from Kelly C. McCants, MD, the Acting Executive Director of the newly formed Norton Healthcare Institute for Health Equity and serves as Norton Healthcare's Medical Director of Advanced Heart Failure. He holds both positions while the Institute for Health Equity is being established. Dr. McCants will spend the next several months assessing where Norton is as an organization and helping to determine a model for the Institute's long-term success. Growing up in Jacksonville, Florida, and Tuscaloosa, Alabama, Dr. McCants has said he draws inspiration from his mother and older brother. He's the first physician and only the fourth college graduate among 54 members of his extended family. His brother, now a police captain, and his mother, who went back to school at the age of 40, were the first and second college graduates. Dr. McCants attended Tennessee State University in Nashville before going on to Meharry Medical College, also in Nashville. He completed his internship, residency, and fellowship at the University of Louisville. He returned to Louisville after a stint in Atlanta, Georgia's Piedmont Hospital, where he was the director of cardiac transplantation. Later, you will hear from Trey Cockrell, Director of Strategic Relationships from Humana. Trey is a senior executive working in the Office of Population Health and Humana leading strategic relationships. Mr. Cockrell's current focus is to collaborate with the University of Houston to support the startup of a new medical school and to help integrate the existing clinical colleges in an interprofessional model that leverages Humana's clinical expertise and application of value-based care payment innovation and integrated care delivery. Mr. Cockrell also led startup, strategy, and operations for Humana's Bold Gold initiative to improve the health of its communities we serve by 20% by 2020 by making it easier for people to achieve their best health. Thank you both for being here this afternoon. Dr. McCants, the floor is yours.
Let's try this again. Okay. Let's see if I can get back into my presentation. You able to see the presentation there? All right, let's try this one more time. Give me 1 second. I apologize. Give me 1 second.
Thank you all for staying with us as we work through these technical issues. We apologize for the delay, but I have no doubt that the content you're about to hear will be well worth the wait. In the meantime, I think we are all ready to have pizza now that we've watched Victoria. Okay.
You're not muted.
All right, can you guys hear me now? Okay, sorry about that. Are you able to see the screen now? Okay. So first of all, thank you, Victoria. When I first accepted this position, you were one of the first ones that I reached out to for some advice, and I appreciate the input. So over the next few minutes, what I'd like to do is just highlight what health equity means as it relates to Norton Healthcare. And if you are able to see this particular slide, I think it's pretty straightforward in that there is a huge difference between equality and equity. And to make a long story short, it doesn't matter how tall you are or where you started, everybody deserves an opportunity to see the game. So as we talk about Norton Healthcare strategic plan over the next 2 years, uh, the Institute for Health Equity is right in the center. We must take care of our employees and our patients, but in order to do that, we must understand that our patients are actually a part of our community. And so on the side of this slide, you see the five imperatives that Gladys spoke about. These are the imperatives that Russ Cox actually has encouraged our organization to embrace. And so establishing the Healthcare Institute is number one. And the goal is to eliminate all disparities that would affect someone from achieving their highest health. And then we do understand that access to primary care is a huge challenge. And so you'll see some investments from Norton Healthcare over the next few years to establishing primary care service areas in local communities. And as Gladys spoke, she leads a team that will focus on leadership in terms of mirroring our community. We understand that in large organizations, historically, there's been a challenge for minorities to assume leadership roles. And we're very aware of that in Norton Healthcare, and our job is to make a difference. And then there's a huge push for education and advocacy, particularly this year. This is an important year as it relates for health policy, and understanding that you must vote for candidates that actually represent your views and interests. And then finally, a dollar investment. I know we said 20 million, but we're in the process of continuing to raise funds to actually use about $40 million to invest in Louisville and the West End to really bring some needed changes to those areas. And so as we move through this presentation, one of the mechanisms that we use for physicians and nurses to communicate is the S-bar strategy. And so what I thought I'd do is actually use that same strategy to talk about current state and where we are in the city of Louisville and our country. So here's the situation. COVID-19 and healthcare disparities have been on a collision course for quite some time, but it's become very apparent since the spring of this year. Some of the socioeconomic disparities and social injustice have collided to cause generational defining changes, and COVID-19 has really brought a lot to light. From a background, police brutality and injustice have removed some historical scabs that has resulted in the bleeding of mistrust and forced us to re-examine how we view systemic racism in America. The economy is at the worst that it's been in the United States in terms of the history of the United States over the last 100 years. To make an assessment and to put it simple, white folks and brown folks are no longer pretending to understand each other. And the recommendation is now is a time for change. So why should healthcare be the leader? This is a quote from the great Martin Luther King. And he says, of all forms of inequality, injustice in healthcare is the most humane. And what I'd like to do is just actually read the quote at the bottom, because it speaks to our current situation and everything that the city of Louisville is experiencing. Socioeconomic status is the most powerful predictor of disease, disorder, injury, and mortality that we have. poor health is when poverty becomes disease. And so normally I spend a little bit of time setting up the stage, but actually Gladys spoke to this area. Where you live in Louisville is extremely important. In fact, your zip code is more important than your genetic code. When you start examining the differences between the life expectancy for what the folks in Louisville on the west side of 9th Street see versus the east side, it is clear that your life expectancy is about 10 to 15 years less just based off where you live. Examine where, in fact, the African American concentration is in Louisville. It's pretty easy to recognize on this heat map. Right in the heart of downtown and approaching westward, there's a sharp demarcation for where most African Americans live in Louisville. And so that 9th Street divide becomes very important in terms of resources, in terms of what you see on the 9th, on the west side of 9th Street, in terms of lack of banks, lack of grocery stores, lack of hospitals, lack of private schools, and compared to what you see on the right side or the east side of that 9th Street. And so as we examine what we've learned from our health equity report, I want to make it a little bit straightforward for you. From a poverty standpoint, here again lies one of those heat maps. And I think you see very clearly where the color changes. And so the percentage of people in poverty in West Louisville is upwards of 29 to 50%. And you can see that it mirrors the image for where most of the African Americans in Louisville are situated. The same holds true for median household income. If you look at the lighter shaded areas, the median household income in those areas is between $23,000 and $40,000. Well, there's a sharp change when you move eastward to the median household income approaching about $140,000. Well, if we're talking about mortgage denials, again, the same holds true. When you examine the heat map, you'll see that in the areas largely populated by African Americans, the mortgage rate denials approach 20 to 30%. Well, even though we were talking about the mortgage rate and the poverty level, the same holds true for employment, education, the lack of transportation, vacant and abandoned properties, and for chronic diseases like cancer, stroke, HIV/AIDS, hypertension, obesity, and heart failure. Let's examine it a little bit closer. When we look at the average residential rate for utility disconnections, you can see at the bottom of the left of the screen that if you're in the green area, the chances that you will have your utilities disconnected are between 0.6 and 10%. If you're in the darker shaded area of purple, you'll see that same utility disconnection rate approaching almost 50%. If you look at the right side of the screen from an education standpoint, the folks on the west side of the 9th Street divide, in terms of what you see in a bachelor's and higher degree of education, is less than 5 to 10%. So we were all put in a state of shock by the coronavirus. And you saw that a lot came out in the media about the coronavirus and its effect on the African American and Latino communities and how this was a disparate effect. And so what I want you to do is just take time to read what I have in quotations at the bottom. It says, if they had died of COVID-19 at the same rate as white Americans, about 13,000 Black Americans would still be alive, 1,300 Latino Americans, and about 300 Asian Americans. And so when I see this, it's very discouraging, but we understand that chronic disease affects vulnerable populations at all times. And so it just so happened that this time it was the coronavirus, but this is a disease that will affect any vulnerable population um, throughout the country. Let's go back to housing. We understand that housing is tied to health, which is tied to wealth. When you look at the picture that I have here, it looks very similar to what we're seeing currently, but I want you to look a little bit closer. This picture was actually taken from August of 2018. And so the media attention that we currently see, while concerning, it's not new. The inequality that has existed in West Louisville has been apparent for many, many years. And I'd like to draw your attention to what I have highlighted in the box here. We understand that in the past 15 years, Black homeownership rates have declined to levels not seen to back into the 1960s. And we understand that some of the historical discrimination practices are still apparent today. I thought this slide was very telling. And when you see some of the things that are represented here from an economic standpoint, we already talked about mortgage rate denials being about 27%, as well as any loan denial, which is pictured at the bottom in terms of what you see for minority versus non-minority applicants. When we start talking about SBA loans and the disaster loans of a parent, you'll see that African Americans never really benefited from many of these particular practices. In fact, the racial wealth gap for African Americans in terms of their ability to earn income is about $4,000 compared to $100,000 for white Americans. And for small business owners that were hit hard by the pandemic to not be able to get an SBA loan, but still be expected to function, you see that almost 41% of Black businesses were closed during the pandemic. When we start talking about what we're facing, I wanted to leave you with four major thoughts. The housing market or the home ownership gap between Black and white America is huge. The fact that supermarkets are no longer present in these disadvantaged or underserved areas is a place that we can have an impact. The fact that our schools in zip codes like 40210, which is in the California neighborhood, are struggling and don't have the resources that are needed to support the students. The fact that African Americans, in terms of their banking needs, is not being dealt with west of that 9th Street divide. So what does that mean for healthcare and where does it start? We understand that nationally hospitals have about $400 billion in investment assets that could be redirected into these communities. And the goal is simple: improve the community, you improve the health, but you can't do it alone. So even though Norton Healthcare is going to lead in the charge, we understand that we can't work in silos. But we understand that healthcare systems are uniquely positioned as leading employers and economic engines in the communities to provide quality healthcare, but really leverage those resources to address economic, racial, and environmental disparities that have been long existing. But more specifically about Norton Healthcare, we've done a community needs assessment, and here are the themes that we hope to address, not only within our Institute for Health Equity, but Norton Healthcare moving forward. We have all identified that access is an issue. And so establishing primary care in those communities is important. We understand that chronic disease affects vulnerable people, but with preventions and mechanisms to increase wellness, we can be successful. We understand that for many of the children in these communities, mental health is a big issue. Many of the children suffer from post-traumatic stress disorder, from gunshots, and some of the things that exist in their household. And so establishing mental health services in these areas is key. So Gladys spoke about some of the things that Norton Healthcare has already done. I just wanted to reiterate those things. And so the $5 million investment into the West End Sports Complex for naming rights was very important. The fact that we're supporting Simmons College, which is the historically Black college and university here in Louisville, Kentucky, to make sure that not only that we establish healthcare programming, but we support some of the other programs that they have in terms of social work and administration services to make sure there's opportunities in these underserved areas for patients and some of the employees to actually pursue careers in the healthcare industry. You saw on the news about the Norton Mobile Healthcare Unit, which will serve to provide preventative services to patients where they live. And the last that you'll be hearing in the future is we plan to actually invest in a care center in the West End, which will hopefully be about a 10,000 square foot facility to provide access and clinical resources to areas in the West End. So in summary, we understand that vulnerable populations are vulnerable not only during calm, but especially during crisis. We understand that it's critical for all stakeholders to work together to make sure that we address the social determinants of health centered around housing, education, and food access. We understand that it's the business community has to lead and commit with the words of action. We understand that it takes a village. And again, while Norton Healthcare will lead in this charge, we understand that we can't do it alone. Thank you. And with that being said, we'll turn it over to Trey to give us some thoughts about what Humana hopes to do from an organization perspective.
Fantastic. Thank you, Dr. McCants. And let me share some slides as well. Sorry. Okay, I'm going to put this in. Okay, can you see that in slideshow mode?
Yeah.
Okay, perfect. Thank you so much for having me today. Thank you, Dr. McCants, for doing really a fantastic job of shining a light on the problem. We know it's significant, and it's absolutely not getting better, and it's not going to get better without the collaboration of a lot of us on the phone and a lot more people. I'm thrilled today to share a little bit about our story. We've kind of been at this population health work for a while. We've been really focused on it in Louisville for at least the last 5 years as part of our bold goal, and I'll talk more about that in a second. We're even focused more now on the health equity space and really trying to evolve our bold goal to that next space. I was fortunate to lead the development of the bold goal work again about 5 years ago, and I'm really proud to be leading our efforts to address these significant health equity challenges in our community. And with Humana, we're absolutely humbled to be part of this prestigious group of organizations in Louisville who are really stepping up to lead this work. So our bold goal that we set a few years ago is to improve the health of the communities we serve 20% by improving access to health, by making it easier for people to achieve their best health, and doing those things that focus on whole person health. So taking into account their clinical needs, their social needs, their environmental needs, and beyond. We started that work in San Antonio a few years ago and have since expanded it to 16 different communities across the country. And again, continue to evolve that work and really are thinking about what does it look like at the next level. We often get asked, so you have this bold goal, how do you get to 20%? How do you measure that? And so we measure the health-related quality of life in the CDC's decades-old Healthy Days metrics. And we focus on the second and third questions here, really asking people about their physical health, looking back to the last 30 days, how many days they've been physically unhealthy, and then asking the question number 3 there about their mental health. How many days in the last 30 have they been mentally unhealthy? Combining those two together gives us an overall metric of how many days in a month someone has had unhealthy days. And our goal is to figure out how do we improve the healthy days metric. So that's been our measure of choice. It's one that has resonated with our population. It resonates with our associates as well. And it's something that gives us a tangible grip on the populations we're looking at so we can really see what we're doing is improving or moving the needle. One example, and when you look at some of the the target populations relative to healthy days, this is what we know. When we look at our group members and commercial insurance, they have about 6 unhealthy days a month. Those in Medicare, about 14. Those in Medicaid, about 21. Those who are food insecure, almost 27. And those who are severely lonely, 30. Which means literally every day of the month, if you're severely lonely, you have physically and mentally unhealthy days. Those with depression, about 22, and with COPD, about 18. And then with diabetes, about half of your month, you have unhealthy physical and mental days. So that's why we really decided to focus our primary work on food insecurity and severe loneliness and social isolation. And we know that from looking at our population and from some interventions we've had in the last couple of years, we were able to make an impact on these across the other populations. Because we also know that there's often complicating factors relative to clinical disease that shows up with those folks who are severely lonely and those who are socially isolated and those who are food insecure. So just a quick timeline over the last 5 years, looking back at what we've done relative to food insecurity. We started some work in an early learnings pilot. We just literally screened 500 patients in one of our clinics in Florida, and we expected about 30% of those to screen food insecure. It actually came up about 46%. And in this test, we took those folks who screened food insecure. We actually got them a box of food to leave with, and about 85% actually took that source and left. But more importantly, we got them to a counselor and someone to refer them to longer-term help. So we're able to get them to a food bank and get them a regular source of food to help solve that food insecurity on a short-term basis. I'll talk more about that in a minute. Broad partnerships with Feeding America, things like developing a predictive model, which we did a couple of years ago, so we can start to anticipate who's going to be food insecure. We've upped our screenings. You can see in 2019, we screened about 1 million people for food insecurity, and we continue to do that. There's a number of different pilots we've worked on over the years, including partnerships with Meals on Wheels, one with a company named Mom's Meals. And then during the pandemic, we started a program called Basic Needs to focus on food insecurity and other things. And we've given out about 1 million meals this year just through the Basic Needs program alone. So we recognize that this is a significant social determinant. It shows up in the populations that Dr. McCants referred and that we were really thinking about as part of our evolution of our bold goal that I'll talk about in a second. But certainly food insecurity for us has been one of the key things to focus on to be able to demonstrate improvement in health outcomes and in healthy days. Second, I mentioned around loneliness and social isolation. Looking back a few years on what we've done here, partnering with the Hunger Action Alliance on a food insecurity and loneliness study in Florida, and then starting to really outreach to members we've identified as at risk for being lonely, and again, creating a predictive model so we can understand which of those members and patients are most likely to show up as lonely. And I think we're all becoming more and more aware of the health complications when somebody is severely lonely. It's equivalent, some studies say, to smoking 15 cigarettes a day. It's as damaging to your health as some chronic conditions, and is really unhealthy when you combine those things together. So somebody who's got diabetes or kidney disease and is also lonely really suffers from severely diminished health outcomes. So again, we focus on screening and scaling these efforts and working on different pilots. With this particular initiative, we've partnered with a company called Papa out of Florida, and we've run some Papa pilots, and it's really a program thought of as grandkids on demand. So taking college students, and I think Victoria mentioned I'm working with the University of Houston. We've taken social work students from the University of Houston and partnered them with seniors who are lonely or severely lonely. We've screened their healthy days pre and post, and we've been able to see that by having a student, a grandkid on demand, make virtual calls to people and just talk to them, to connect to them by phone and by FaceTime, really just to interject some human companionship in their life, has had a dramatic reduction on unhealthy days. We've seen it about cut in half, mental and physical, which is amazing to me to think just a simple phone call will have that kind of an impact. We know we have members that are really isolated. We had somebody in this program not too long ago who got a phone call, and we happened to notice it was on his birthday when the phone call came through to enroll him in the program. And he said simply, "You have no idea how many years it's been since somebody wished me a happy birthday." So just making that connection, that human connection, is something that we think we can do more and more through to impact these social determinants, specifically around social isolation and loneliness. So the next evolution of our bold goal really hits more at the topic here, and that's around health equity. And how do we improve health equity, and focusing on that slide Dr. McCants showed, where every person has the opportunity to attain their full health potential, and no one's disadvantaged from achieving that potential because of social position or other socially determined circumstances. So that focus for us is really an evolution of the bold goal. It's designed to start to go more upstream and really to start looking at the root cause of some of the issues. One of the things I was proud about a minute ago is that we've given away about 1 million meals through our basic needs program. But we know that feeding people who are hungry is essential. If people don't have food, we've got to get them food. And that's a responsibility of a lot of us in each community to do that. If we know someone's food insecure, we want to do what we can to get them to a source that helps address that food insecurity. But neither one of those things is solving the larger problem and really preventing them from being food insecure going forward. That really is how we start to look further upstream and really think about what are the root causes of the things like food insecurity and social isolation and loneliness, and how do we start to eliminate the disparities that are creating those things. So really those preventable differences in the burden of disease, injury, violence, anything that can prevent someone from achieving their optimal health, and those disparities we want to start addressing in a different kind of way. We've done it, like I said, through a number of different initiatives, but doing it a little more purposefully and really figuring out how do we peel back the layers of the onion even further and address these kind of these issues that are going on in our community with a little more purpose, a little more intent, and a little more investment. The other thing we know is that these things in Louisville in particular didn't happen overnight, and they're not going to get solved overnight. They're not going to be on our company's next quarterly earnings report. So this is something that's going to take time. Solving these really complex issues is going to take human and financial resources and new and collaborative approaches to approach these issues that have been rooted in our society for so long. And so that's something that's going to take a commitment from organizations like ours and the others on the phone and others on this call to continue to address. We've started looking at claims and cost data across our membership in Louisville in particular, focusing on those zip codes that Dr. McCants shared earlier, primarily in the West End, and then also looking at some publicly available data, some of the data that he shared. We've seen some of the same data, and certainly our Louisville Health Equity Report that came out just a few years ago. And evaluating all that data, we've started to hone our focus, thinking that if we can really get to a narrow geography and a narrow patient set, we can start to measure and demonstrate some sustainable change in a particular community. So rather than looking broadly at what can we do in all of Louisville, it's starting with that really defined geography in the West End and starting with some of these populations. Our data would tell us that hypertension in Black males in the West End compared to the rest of Jefferson County and compared nationally is extremely high. And that's something that we also know often goes undiagnosed. So there's a tremendous opportunity for us to think about how we look at hypertension specifically in Black males, but even more broadly in the population in West Louisville. But how do we focus on those things that we can then start to put some structure around? We think that's one place we can focus to start to make a difference. The second, we know that maternal mortality in Black females is a significant issue. Black women are 3 to 4 times more likely to have complications with pregnancy than white women, and that includes death. So that's something that should not be tolerated in our society at all, and something, again, we want to focus on in that same population to understand in collaboration with so many others, how can we have an impact on that particular statistic that's just something that we can't stand for in our country and in our community. And then the last one, which I think is equally important, is looking at just overall poverty, lack of employment opportunities, and lack of access to healthcare. We know that those issues of disparity really lead to poor health outcomes for this population. And those issues stem from, again, long-term racial segregation issues that run deep in our community's history. And so we think that there are some things we can start to do, again, partnering with Simmons College, as Norton has, to focus on some scholarships and some pathways to education, looking also at Kentucky State, other places with the University of Louisville, to continue to expand our reach and our focus on growing educational attainment that'll lead to higher sources of income, more sustainable employment. And we think that starts to get more and more at some of the root of the issues that are going on. So by way of taking action, we've got a number of different work streams that we're focused on. I talked a bit earlier about the quantitative data analysis and looking at our member data. Perhaps even more importantly is the qualitative side, and that's really listening and learning. Spending some time out in the community, talking to people, understanding what they see as the barriers to health are, really in line with where we started our BOLA goal a few years ago, is just asking and listening, and letting people be heard and building trust with them to know that, while we've been in the community for 60 years and we've made significant investments along the way, Humana is a partner that's committed and is willing to make a long-term financial and human capital commitment to these kind of problems. So that qualitative piece is important for us. Increasing the number of resources in this area through community health workers and others is something that we're exploring, looking at different ways to eliminate barriers to access, as Dr. McCants talked about as well. And then thinking about other collaborations. So we've made an investment also in the Urban League Sports Complex. Our foundation's made an investment in Simmons College. So looking at different partnerships and other ways we can collaborate in the West End, bringing, as I said earlier, new approaches, new innovative approaches to solve some of these historic problems, as something we think we can really focus on. And then the last one I spoke about a little bit a minute ago is around workforce development and creating those educational employment pathways. So I'll stop there, and I think we have a little bit of time for some questions, but really just want to express my gratitude personally for everyone on the call as well, and then also for the opportunity to step up and lead the work on some of these challenges. So thank you.
Thank you so much. Appreciate those comments. And I'm hearing some feedback in the background. I'm not sure if that's just on my end or what's happening there. I think that took care of it. Thank you, Morgan. All right, well, we've got a couple of questions that have come in through the chat, and some of this was threaded throughout the presentations, but I think it would be helpful to hear it in the perspective of how this question is asked. So if I could ask each of you to just address the one or two obstacles top of mind that prevent people in underserved areas from receiving healthcare services, what would those be? So Dr. McCants, I'll ask you if you can answer that first.
Yeah, so I think it's clear that access is the biggest obstacle. Again, having care clinics in the communities where patients live has always been an issue, not just in Louisville, but across major metropolitan areas. And so to get healthcare systems to really be the anchor in those communities is important. And I think one of the key issues, at least here in Louisville, is transportation. We notice that a lot of folks in those areas that are disadvantaged and underserved don't have access to transportation. And so if we can't get patients to the clinic, then it's hard to have that impact. And so if we could focus on the access and the transportation in terms of getting people to the clinics, I think that's extremely important.
Add to that, I totally agree with you, Dr. McCants, but I would add to that and say that trust has also become an issue. I'm not sure people trust the healthcare system. People, just really, I think over time have said there's not going to be an investment in me and my health, and I think to be able to demonstrate otherwise, people are waiting for that. I think they need to see that they can trust a system that's going to help them in the short, medium, and long term. And I think that's done through access, through transportation, through providing resources to the folks who are in need that are going to solve those longer term issues.
Excellent point. And I do think these are the very types of conversations we have to continue to have for us to work toward change, not just to benefit our communities of color, but our community as a whole. So next question is Greater Louisville really unique when it comes to these disparities in care? We are a very segregated city, but do we see this kind of issue with the underserved populations in other metro areas in our peer cities? Have either of you done any research on that?
start there. Working with the University of Houston, we've done a lot of work. That particular university is an urban campus, much like U of L, and it's situated in the third ward of Houston, which is not only happens to be where George Floyd came from, but happens to be one of the most underserved populations in that community. That university, like ours, has made a significant commitment to helping serve that community and conduct different pilots and programs and initiatives to help, again, improve those initiatives that are causing the problems in that community. So I don't think we're unique, but I do think Louisville has some slightly different challenges based on some of the history of our community that probably is different from a Houston or a San Antonio or a Chicago or others.
Yeah, if I could add to that, I think in most of your major metropolitan areas, where there's been some systemic issues from the past in terms of segregation in those cities, from redlining and unfair housing practices. That's really the root of what we see. And in fact, if you look at cities like Memphis, St. Louis, Minneapolis, any of those cities that have a predominant large African American population, you'll see some of the same challenges. And unfortunately, these are also some of the same areas that are being highlighted in the media for the social unrest as well.
Great point. Excellent point. So as we think about how we interact with our underserved populations, what sort of training programs are in place, both at Humana and Norton, to address that? We've talked about a little bit of the training that's in place, but if you could elaborate just a little more on what your programs look like, I think that would be very interesting for our viewers today.
One of the things we embarked upon not too long ago, but one that's recent, is a data upskilling and retraining initiative. Our goal is really to help people who want to get into the data sciences understand what that means. How do you get them started in that career, and offering them some foundational education to become data scientists or data analysts, recognizing that the ability to leverage data, glean insights from data, and be able to conduct high-level data analytics is an important and evolving part of almost all of our companies. So that data upskilling program is one that's important to us. We also recently announced a partnership with JCPS to bring students into one of our facilities so that they'll have consistent access to Wi-Fi, to a classroom kind of space that's a little more technologically advanced in their schools. So that partnership for us is really important, and something that's just starting, I think, October 5th or 6th. We'll have those students in our building for a part of their time going forward. So those are a couple things, and I think also for us, it's as I mentioned earlier, starting this partnership to really educate people differently as we think about community health workers and other people who are providing clinical direction, these non-credentialed clinical workers in communities, to continue to raise the bar on their education. So think about somebody who comes in as a basic community health worker, to get them 2 or 3 levels of education as a CHW, ultimately, hopefully get them into a social work program or a nursing program, and into a different level of education that allows them to get a different kind of employment and change the game, and be maybe the first in their family to get those kind of degrees, and again, improve their economic circumstances.
So I'd like to answer that question also, and then maybe have Gladys give a couple comments about the important work of our employee resource groups. But the most important thing that Norton Healthcare has done has been on the direction of our CEO. You understand that the most important thing that he has done is foster the right environment to address some of these uncomfortable issues. And we've been very transparent about some of the strengths and weaknesses as an organization that we have, doing weekly videos to discuss the social determinants of health, and really keeping everybody informed about what Norton Healthcare is doing in terms of its imperatives has been key. And, like I say, Gladys, I don't know if you want to comment about some of the employee resource groups and some things that are going on there.
Sure. So some of the things that we've been doing as part of imperative number 3, which is having our leadership reflect the community, is we also are looking at that from a holistic perspective, the entire organization. And one of the things that the employees that are working on this imperative have identified is a critical component of pipeline and pathways. So once we have employees that are starting with the organization, letting them know what we truly have available and making it available to them in a way that is accessible. So we recognize we have frontline workers who aren't always in front of their desks or a computer and can always see what we have posted on our Norton University site for opportunities. So we're developing and looking at ways where we connect with individuals on a level that meets their needs at the time that it's needed.
Very well said. Thank you. And I believe we are about out of time now for our session today, but I think this has been an excellent conversation. And I want to thank Dr. McCants, Trey Cockrell, and then also Gladys Lopez, our new work stream chair. And thank you for joining us today. And a final thanks to our sponsors, Papa John's International, Brown-Forman, Humana, Yum Brands, the Oliver Group, Morales Group Staffing, PricewaterhouseCoopers, and Tops Magazine. This really is important work, and GLI is all in on making significant strides to addressing our racial equity issues in the community. Please go to www.greaterlouisville.com for more information on our speakers. And if you are a member for the Business Council to End Racism Access to Healthcare work stream, please enjoy this 15-minute break and then join our post-event discussion through the Zoom link that you were sent in advance. It will start at 2:15. Thank you again, and we look forward to seeing you again virtually soon. Have a wonderful afternoon.